I'm delighted to say we can speak to the General Secretary of the Royal College of Nursing, Pat Cullen, now. Thanks so much for joining me. So clearly escalating the strikes in quite a big way. Tell us why.
Well, first of all, with a very heavy heart, this escalation was announced today. And it's simply because we can find no resolution with this government to the strike on behalf of every nurse that I represent.
You mentioned in your statement towards the end of it that this action that you're taking, already taken and will be now taking more of, must not be in vain. Are you concerned that there's a chance it might be?
No, I'll never give up hope that the government will come to the table and start to find ways to talk to us to resolve this strike. On behalf of every single nurse that has taken part in strike so far, and indeed, and more importantly, on behalf of our patients. So I can't give up hope. But what I'm saying to the Prime Minister today is please choose talking over strike action, and saving the NHS is really, really important to every single nurse that I've written to today to announce the next 48 hours to.
And what if he said back to you what you just said, choose talking rather than strike action?
Sorry, could you repeat that to me, please?
What would be your response if the government said to you exactly what you just proposed saying to him? Choose talking over strike action.
I would be absolutely delighted. I would say to him, which table do I need to be at right now? And I will be at it. Doesn't matter what time of the day or night. I will be there to represent the 100,000 plus nurses in England that will have to take part in this strike action at the beginning of March if this government continues to not get into a room and start to negotiate. So there will be no, we will not be found wanting within the Royal College of Nursing to try and bring an end to the strike. We'll do that on behalf of every single nurse and every patient that deserves better in this country.
And do you have, sympathy is not the right word, but do you have any sort of vague, well, I use sympathy, but it's not quite the word I'm looking for the government in terms of the challenge they have at the moment with so many different sectors striking, some with more legitimate grounds than others, a debate for others to have, that if they agree to a percentage price rise for one sector, however deserving they might be, that it sets a precedent for other sectors?
Look, those are tough decisions that the Prime Minister must take. That's very tough decisions that people that hold high elective office must take all of the time. But I'll tell you who I've serious sympathy for. It's every single member of nursing staff that are coming on shift at 7 o'clock in the morning and at 8 o'clock in the evening, knowing that half of their workforce isn't going to be available to look after their patients, and that they're doing their very, very best to reduce the risk that our patients are facing every single day, because we have 47,000 vacant posts in England. I have sympathy on all of those nurses that when they want to go off shift and start to go home, that they're faced with the position where they can and are struggling with paying their utility bills. So my sympathy lies with them, but also my thanks lies with them as well, because without those nurses continuing to work in the crisis that they're working in, what state would our health service be in? And they are continuing to look after their patients against all odds every single minute of the day and night.
In terms of your point of every single minute of the day and night, clearly there's a difference in this set of strikes to come on the 1st of March, that it will be for 48 hours solid, not just 12 hours during the day. You say in your statement, I'll do whatever it takes to ensure patient safety is protected. Presumably that is harder to do in this round of strikes than the previous ones, given the 48-hour nature and given that intensive care and other areas are included for the first time.
Of course it is. I'm not going to deny that this will put serious pressure on the NHS, even more pressure than it's under at the minute. It'll put pressure on those nursing staff that are continuing to try and provide services. But what I will say to every patient that's listening our nursing staff will not create any further risk that you are continuing to face every single day. But, and there is a big but, there will be pressure found, as there has been during the first 6 days of strike that have happened to date during the first 3 months. But this will involve nursing staff that have not taken strike in the first 3 months, and they will be involved in this strike. But again, my plea is back to the Prime Minister. Please step in. Please try and get around the table and talk to me, and let's save the NHS from the crisis that it's in.
So given that it will be harder, will patient safety be at risk?
There is no doubt in every single member of nursing staff's mind the risk that patients face every single day. How can they not be facing risk sitting on waiting lists, 7 million plus people sitting on waiting lists year on year? There's serious risk associated with that. The risk that's associated with 47,000 nursing staff missing in England every day when those posts should be filled. How are we going to get those posts filled? How are we going to make sure that we can keep our nursing staff in the health service and recruit more nursing staff in? By paying them a decent wage, resolving the pay dispute that they've got for this year, and then look at what we're going to do in the years to come. But this is for the Prime Minister to resolve, and resolve as a matter of urgency.
On the pay part of it, and I know it's about much more than that, but it's perhaps the most tangible thing that we can discuss here. I think you originally asked, and please correct me if I'm wrong, for 18 or 19%, and the government offered 4 or 5. And at some point in the last few months, you said on Sky News that you'd be willing to meet halfway. Is that still the sort of position, somewhere between 5 and 18%?
I have never put a figure on it, actually. I've said let's meet halfway. I've also said that we won't negotiate in public. We actually owe it to every member of nursing staff to get around a table, have those talks together at that table. I will lay out the plans I've got for our nursing staff that will bring an end to these strikes and ensure that our nursing staff can get back inside their hospitals, care for their patients where they want to be, not standing on picket lines, losing another day's pay. And the Prime Minister can set out his plans, and let's come to an agreement. That's what nurses do. That's what talks achieve. So let's start talking.
If inflation falls, because it is likely to do that in the months ahead, based on various economic forecasts and comparisons to last year, would your demands come down as well if inflation comes down?
Look, I've said time and time again, we will meet the government halfway. We'll get round a table and we'll start talking. We'll take into consideration everything that the Prime Minister wishes to put on the table, and we will discuss that. We'll put it to our nursing staff. We'll have those discussions, and I'm sure together we can find a resolution to this. But resolutions can only be found in a room when we start to talk. And I am ready and willing to talk to the Prime Minister day or night. I can't make that any clearer.
Pat, we definitely hear you loud and clear on that, and we really appreciate you joining us tonight and answering all of our questions. Pat Cullen.